I too would like to respectfully acknowledge the traditional owners of the land on which we meet and acknowledge elders past, present and emerging, although I have to say I can never do it as well as Robin. Never, ever. I would like to acknowledge my fellow colleagues, Councillor Russell Lutton, who's the Chair of Planning, Councillor John Raven, who is the Chairperson of City Centres Special Committee, which the Meadowbrooks, the summit sits under his purview. Councillor Jenny Breen, Councillor for Division 12, has already had one of these summits in her electorate, and we're moving to get that, make that happen, make the results of that happen now. Not too sure if Darren's here, I haven't seen him, but I do have apologies from Councillor Steve Swenson, Councillor for Division 3 and Chair of Lifestyles and Communities. Unfortunately not able to be here. I'd also like to acknowledge our Acting CEO, Silvio Trenker, and the many other directors and managers of Logan City Council in the room. Also a special welcome to Amanda Newbury and the team from Articulus, and I'm really thrilled that one of those team is Mark Dooner. I have known Mark for over 20 years and he never ceases to amaze me as a planner. We're also honoured to have such a distinguished lineup of speakers. We're a very young and emerging city. We have a current population of 319,000 people. That's expected to grow to almost 500,000, although some figures I was reading late this afternoon put that figure at about 580,000 people by 2041. Yeah. Extraordinary growth, 1.7% a year for as many years as I know, and in some stages in those years we were growing at 8%, and I think Russell was in the Chair of Planning at that stage, and I don't envy him that job. It must have been intense. But we need to create more employment opportunities. Another thing I was reading some things today about transport and planning, and we need to do things like, the magic figure is a 30-minute city, the other magic figure is a 45-minute region. The way you do that is not take people to the jobs, you take the jobs to the people. And so that's what we're looking for in most of our centres, is to get the jobs to the people. Logan's already a major economic destination. Our robust economy has major potential to grow and diversify. And we need to add a stronger focus on technology. One of the other things I was reading about today, getting that higher job value, the technological jobs, your demographic changes, your basic population changes, and it makes a huge difference to the city. But we need the knowledge-based industries, and they can grow and be supported by our healthcare and knowledge institutions such as the Logan Hospital, Logan TAFE, Griffith University. Meadowbrook is one of our key activity centres. It is our developing health and knowledge precinct. And as I've just said, the hospital, the TAFE College, the university, and it has a railway station, and it's close to the M1. That is just a magic mix. The Meadowbrook Master Plan was endorsed by Council in December 2016 and represents a shared vision of Logan City Council, the Queensland Government, Metro South Health, and I'm really glad that they're here today. And, of course, Griffith University and TAFE Queensland. So we've already created a partnership. And this is to create a place focused on health, education and wellbeing, our very own health and knowledge precinct. And I think this is really important because everybody's looking at having what we already have. Everybody would like the university and the hospital and the TAFE College and the railway line all to be close together. It's already here. We just have to make it work better and bigger. It's also an important place for our smart, diverse, aspirational young people. It's a place where people can study, continue their education and gain qualifications for their dream job. And it's also an important place for our hard-working, busy and growing families. And I'd like to recognise there's a number of residents from around this area in the room tonight, and I would like to thank them for their time in coming. We really appreciate the fact that residents have taken an interest in this. Meadowbrook is also an important place for seniors. Those of you who know Logan will know this, but those of you who don't will know that we have a cluster of high-quality retirement and aged care facilities just down the road in Bethania. As well as in Shayla Park and Logan Home. And, they're sprouting up all over the place. And that supports, obviously, with you have that aged care community, the hospital is more important than ever. And that means the hospital has 75,000 inpatient admissions and over 300,000 outpatient admissions annually. That is a massive number. For the shared vision to create a place focused on health, education and wellbeing, a health and knowledge precinct to move forward, it is vital that the key stakeholders work together to create, to just grab every opportunity that comes. And I was being asked about things like incentives earlier, and I'm sure if you talk to council planners, you'll figure those out. We need to collaborate on a local and regional scale. We need to complement groundbreaking work in other similar precincts in SEQ, such as the Sunshine Coast, who are doing very, very similar things. But there's also at Hurston, where QBH is, Southport, with the Gold Coast Hospital, Springfield, with the Mater Hospital out there, and Kawana on the Sunshine Coast. We need to find key specialisations that make Meadowbrook work. One of my major, and I was speaking to somebody earlier today, and I'm sure they're sick of hearing, most planners are sick of me hearing, anybody that's done commercial business in Logan while I was planning chair would have heard from me, when are you going to bring medical specialists to Logan? We need them. It's one of the most important things that I see, because we have a fairly young demographic, so we have the nappy belts, the baby suburbs where there are small children, and I can tell you as a woman, and the men don't understand this, I'm not too sure if you do or not, 2 children, pregnant, getting on a bus to go and see your gynaecologist, no thank you, it's too hard. And especially when that bus is about a 3/4 of an hour ride. It is not fun, and no one wants to do it. So you drive, and then you get caught in peak hour traffic, and you've got to pick up the kids from school, and it becomes a nightmare. So more specialists, please. And I'm going to keep singing that song while I'm in council and probably after. As part of today, though, I'm interested in hearing what our key stakeholders have got to say about how we build on what we've got. Or what we've got already is good, but we need to make it better. Improve the collaboration and create a truly specialised and successful health and knowledge precinct for the people of Logan, and it's not just Logan, it's also South East Queensland. We service a lot of people in South East Queensland. Please get involved as much as you possibly can with the discussions, and we look forward to hearing all of your great ideas. Have a wonderful evening. Thank you very much.